Our strong sense is that one of the keys to population health is going to be around mobilisation of communities. So how can we get people much more active in their communities in improving health and in tackling some of the social determinants of health? So how can we get people to take more exercise? Well, part of the challenge there is that they don't feel safe exercising in some communities, or they don't have green space. How can we get people to eat more healthily? Well, some of the challenges are sometimes that access to food is difficult in certain communities. So unless we start to tackle both mobilisation and the social determinants of health, we will probably fall short of the triple aim. And so that is why IHI is encouraging people to think about health and to think about that in a different kind of way. So I think there are probably three areas that where we are on a developmental path in IHI, and I would like to accelerate that. The first is around our reach as an organisation. There is so much improvement to be done that we need to start to reach more people, to grow ever stronger and ever larger that army of improvers who are going to be able to tackle this. And that's going to mean using new ways to teach and learn. It's going to mean attracting new people to think about quality improvement, but extending our reach is a first priority for me. Then I want to think about the theme of our conference, this whole idea of recharging. And we've been tackling this through the lens of joy at work. So how can we flip the conversation from being about burnout to being about genuine engagement of our clinical staff? How can we turn around the conversation to thinking about how can we make the healthcare workforce a joyful place? And again, I'd like to see us make some progress on that. And then my third priority is to continue the work that we've been doing towards health and healthcare. In a keynote session that Maureen Bisognano and I gave last year, we talked about "and" being the new "or", and I think we're still making too many choices about whether we should improve health or healthcare. And I would like to see us move towards a situation where we're trying to improve health and healthcare. I think we're making progress. I'm beginning to see many excellent examples of hospitals who are engaging with their communities, who are available to their communities, who are becoming better partners with their communities. We see that as part of the work we're doing on 100 Million Healthier Lives. We have a healthcare transformation hub there, where people are coming together to share some of those ideas. We're seeing it in our IHI Leadership Alliance, where we have organisations who are working much more closely with their community partners to really understand what communities need, and then to deliver in partnership with those communities a set of much more integrated services that will meet those community needs. The advent of the community health needs assessment that many healthcare organisations need to produce is again starting to inform that work in a much more valuable way than has been possible in the past. And so I see some real progress, Marty, as folks start to think their way through that. I think it's probably never been such a challenging time to be a healthcare leader. There are so many changes that all of us are trying to juggle with. And I think that's the case right across the developed world. As I talk to healthcare leaders in Europe, they're facing many of the same kind of challenges as they are in the United States. And the positive aspect of that is, therefore, many of the solutions are also shared. If the challenges are the same, it's possible too that the solutions are. And so I think we can now start to create for leaders a much more extensive learning environment. We can help to connect them with innovations and new models of care from right across the globe. And so my message to leaders would be, don't worry alone. I used to say regularly as a healthcare leader in my home country of Scotland, steal with pride. Yeah, let's figure out together how we can tackle some of these challenges, and the opportunity for leaders is in collaboration.